Next up, we have Cassandra Clark. Cassandra Clark is a doctoral candidate in the Environmental Health Sciences Department at the Yale School of Public Health. She combines previous training in biogeochemistry and toxicology with her doctoral training in exposure science and environmental epidemiology to conduct policy-relevant research at the interface of human and environmental health. Her doctoral dissertation applies environmental monitoring and epidemiological data to evaluate exposure to compounds related to unconventional oil and gas development to improve our understanding of childhood cancer risk.
All right, well, yes, thank you for that great introduction. And I'm really happy to be able to present to you today. So my name is Cassie. I'm a doctoral candidate at the Yale School of Public Health. And my talk today is entitled Socio-economic and Demographic Predictors of Oil and Gas Complaints and Determinations in Pennsylvania. Unconventional oil and gas development, which is abbreviated here as UOGD, has been linked to numerous environmental and human health impacts. While there remains some uncertainty about the extent and the frequency of these impairments, there is evidence that this process potentially can threaten water resources and air resources, as well as the physical safety of communities residing nearby. Nearly 30 epidemiologic studies have been published over the past decade, and most of them have described have noted adverse health effects associated with residential proximity to UOGD, which include things like cancer, asthma, and adverse birth outcomes. A growing body of literature describes how environmental health burdens related to UOGD may also be differentially distributed based on socioeconomic or demographic factors, such as race, ethnicity, and income. And so this literature, taken in tandem with the epidemiologic literature, suggests that those living near UOGD sites may bear significant health and environmental burdens. Given the potential for these impacts to the community, filing complaints is one mechanism of registering an environmental issue. And so filing a complaint may reflect a combination of several factors, including the physical presence of a problem or an issue, empirical observation of a problem, perceived impact and active reporting of a problem, or lack of municipal response to a problem. Socioeconomic status and demographic factors have been thought to influence all of these aspects, and they're also thought to influence both the need for municipal service and the awareness of those services. So, in other words, the need for municipal services is not always proportional to the utilization of those services. Beyond these barriers, areas with legacies of pollution may also mistrust their government, which leads to decreased citizen-initiated reporting of issues and decreased meaningful engagement. So even if hazards like spills or pollution were equally distributed among shale-producing areas, the recognition and reporting of those hazards may still be unequal. And so because of this, there could be unrecognized impacts of UOGD due to procedural inequities in reporting and response. Dr. Cushing gave us an excellent introduction to the principles of environmental justice. And to that, I'll just add two principles that I think are really key here are that no group should bear unequal distribution of environmental hazards, and that all should be entitled to equal protection under environmental policies and standards. And beyond the barriers that I discussed related to trust and meaningful engagement, people who wish to file complaints may also face logistical barriers such as understanding of the complaint process, even access to the tools necessary to file the complaint, such as a reliable internet connection, or access to the physical office that receives the complaints. And so considering these factors allows us to see the filing of complaints through an environmental justice lens. In Pennsylvania, an oil and gas complaint can be filed with the PA Department of Environmental Protection, which I abbreviated as PADEP, by any landowner, water purveyor, or otherwise affected individual. And the individual, upon noticing an issue related to oil and gas development, notifies PADEP by filing an environmental complaint. And filing a complaint related to water quality or water supply prompts an investigation by PADEP, which is supposed to occur within 10 business days of the filing. For a determination to be issued by PADEP, a complaint first needs to be filed to prompt those investigations. and only complaints related to water supply issues proceed to the investigation stage. And so of those completed investigations, some result in positive determinations, which are instances of confirmation of impaired water. Some result in negative determinations, which is no evidence of water impairment, and some remain undetermined. So to identify potential procedural inequities throughout the complaint and determination process, our aims were to evaluate associations between county-level indicators of socioeconomic status and demographics, and 1, number of oil and gas complaints filed, 2, number of positive determinations made, and 3, proportion of water supply investigations resulting in a positive determination. For the 36 Pennsylvania counties with drilling activity during our time window, we compiled socioeconomic, demographic, and drilling information from multiple data sources. So to compile the socioeconomic and demographic data, I went to the US Census and American Community Survey, and from those I was able to abstract information like median household income and racial and ethnic distribution for the various counties. From PADEP, I abstracted oil and gas unconventional and conventional drilling records for the years 2004 to 2016, and the water supply investigation and determination records, totaling 271 investigations between 2001 and 2020. The PA Public Herald provided the oil and gas complaint records, which totaled about 9,400 complaints over the years 2004 to 2016. To identify our final endpoints, we cross-checked the Pennsylvania Herald and PADEP reported complaints datasets. So recall that only water supply complaints are investigated. All other categories, which are shown on the right side of this figure, are not eligible for determinations. So only a small number of water supply complaints were not confirmed between the two datasets. And then our endpoints were, for AIM 1, all of the complaints, water supply and otherwise. For AIM 2, the number of positive determinations, which was 215 for our years. And then for AIM 3, the proportion of positive determinations out of the total completed water supply investigations. So our final multivariable models included a range of socioeconomic and demographic variables, as well as drilling activity variables. And so with these, we really wanted to cover a range of SES and demographic domains like income, education, and race and ethnicity, while also maximizing public health relevance and limiting correlations between the variables. For AIMs 1 and 2, we used hierarchical Poisson regression. And so this is the appropriate model to use when your outcome is a number, in this case, number of complaints and number of determinations. For AIM 3, we used hierarchical logistic regression. And so this is a model that's designed to be used when you're modeling a proportion in this case. So proportion of investigations that yield a positive determination. All regression analyses were conducted in the Bayesian framework at the county level, and the unit of analysis was county year. All of the models included the following components: an internally standardized population-based offset variable, the purpose of which was to account for population size between the different counties; spatially correlated random effects, which account for similarities between neighboring counties in demographics or SES; a random effect to account for repeated measurements, as we had 12 years of information for every county; and a linear time effect variable, which describes large-scale changes in outcomes across time. And so the association that we calculated for AIMs 1 and 2 was a rate ratio, and for AIM 3, it was an odds ratio. This table shows the characteristics of the 36 counties with unconventional or conventional drilling between 2004 and 2016. So there's a lot of information here, but some things to note are that we had pretty limited variability in racial and ethnic distribution among this population, with the primary race being white, It was overall a very rural set of counties. This is not terribly surprising. The most common form of educational attainment was a high school diploma or GED, which contributed to our choice to use that measure in the final models as a measure of educational attainment. And these counties experienced vast differences in oil and gas development activity over this time window, as well as vast differences in number of complaints filed per year. In terms of temporal trends, so this chart shows the yearly UOGD activity alongside the yearly complaints and determinations. So UOGD drilling intensity, which is represented by the gray dashed line, increased sharply after 2005 to peak in around 2011. And the number of annual complaints, which are shown in orange, also rose really rapidly after the introduction of UOGD. Though note that there were some complaints prior to this, so those were mostly associated with conventional drilling. Positive determinations are shown in blue and also on a separate axis on the right-hand side. So those followed a similar pattern to complaints, though the first determinations were not made until 2007, and the maximum number were made in 2010, which was actually slightly earlier than the peak in UOGD activity. This table shows the results of our multivariable models. And so for those of you who may not be familiar with risk ratios and odds ratios, a value of 1 represents a null effect. And so if the confidence interval, which is shown to the right of the estimate itself, includes 1, the result is not statistically significant. And so a result below 1 indicates a decrease in the effect, and a result above 1 indicates an increase. So to summarize here, a risk ratio for the relationship between median household income and number of complaints filed was 1.47. And so what this means is that there was a 47% increase in the rate of complaints filed with each $10,000 increase in median household income. So more simply put, the higher the income, the more complaints were filed. Similarly, the risk ratio for the relationship between complaints and educational attainment was 1.18, meaning there was an 18% increase in the rate of complaints filed with each 1% increase in population with a high school diploma or GED. For number of determinations, the risk ratio for percent AAN, which represents African American, Black, Asian, Native American, and Indigenous, and other races combined, was 0.73. And so that can be interpreted as a 27% decrease in rate of determinations made per 1% increase in percent AAN population. And similarly, for the proportion of positive determinations, the odds ratio for percent AAN was 0.78. And so this means that there was 0.78 times the odds of a determination being made per 1% increase in AAN population. Also notable in that third outcome, percent Hispanic had an elevated odds ratio of 2.13, which goes in the opposite direction of percent AAN, but this was not a statistically significant result. Drilling activity, perhaps unsurprisingly, both conventional and unconventional, was consistently associated with more complaints and more determinations. So I'd like to discuss some of the predictors in a little bit more detail now. So overall, our results indicated that higher socioeconomic status, income, and education seemed to be associated with more complaints being filed, though that association did not persist for determinations. This could be for a number of reasons. It could be that wealthier areas with higher educational attainment may be more likely to engage with their municipality. They may be more likely to participate in political or community organizations, and so may have greater kind of awareness of these issues. They may have improved access to the resources necessary to file a complaint. They may have more time to devote to environmental and health concerns. And they may have more trust in their municipality, leading to increased meaningful engagement with that municipality. So the picture with respect to the positive determinations is less clear. It's difficult to draw inferences about determinations simply because a very small number of complaints yield a determination. Only about 5% of the investigations yielded a documented impairment. But overall, what our results suggest is that filing more complaints may not necessarily lead to greater municipal recognition of those complaints. As far as race and ethnicity, the number and proportion of positive determinations were both associated with race, while number of complaints was not. So this could be for a number of reasons as well. Potentially, there could be less recognition, investigation, or acknowledgement of problems occurring in areas with more historically marginalized groups. Conversely, it could be that potentially there are fewer documented problems occurring in areas with a higher proportion of minority racial groups. Existing as a counterpoint to this is the research that you've heard a little bit about already from Dr. Cushing and Dr. Johnston, where they saw in Texas that wastewater disposal wells were disproportionately sited in neighborhoods comprised of people of color. And you heard a little bit about their flaring research as well and how that disproportionately impacted people of Hispanic ethnicity. So Pennsylvania is quite different demographically than Texas. So it's difficult to really draw comparisons between the two, but that research exists as a counterpoint to that idea. Overall, we had really limited heterogeneity with respect to race and ethnicity within this study population. So we had limited power to appropriately investigate the impacts to individual racial and ethnic groups, which made these factors relatively difficult to assess. And again, unsurprisingly, drilling activity was consistently associated with more complaints and determinations, with unconventional drilling generally having a larger effect size than conventional drilling. It's possible that increased drilling activity leads to making the industry more visible, which could lead to more complaints filed. And as far as positive determinations, our results could mean that the likelihood of an instance of water impairment could increase with more drilling activity. There have been about 215 positive determinations and around 8,700 wells drilled over our study's time window. So again, a relatively small occurrence of, or a relatively low occurrence of impairments. But ultimately, our results do indicate that increases in drilling activity are an important driver of both complaints and determinations. So this analysis contributes to a limited but growing body of literature, which describes oil and gas activities through an environmental justice lens. And we focused on the reports of residents about their observed or perceived threats to their drinking water or air. And so this offers a really unique endpoint, which represents citizen participation and perception of issues to assess patterns in reporting and municipal response, which allows us to kind of get a new understanding of the impact of oil and gas activities. I've mentioned some of the limitations already, but to add to those, county-level aggregated data can obscure heterogeneity within smaller geographic areas. We also had, again, really limited power to investigate impacts to individual racial and ethnic groups, and the small number of positive determinations limited our inferences. In conclusion, we identified multiple socioeconomic and demographic predictors of complaints and positive determinations, including median household income, educational attainment, and race. The volume of complaints filed during this time demonstrates serious public concern over oil and gas activity and could also be reflective of some psychosocial stress among the population. Understanding patterns in complaints and determinations can help inform additional surveillance activities, distribution of public health resources to ensure equitable protections and enforcement of environmental policies and regulations. So this was done as part of the Yale water study under the mentorship of Nicole Diesel, who presented earlier today. And so I'd also like to acknowledge all of my collaborators, my funding sources, and in particular, the Pennsylvania Public Herald for sharing that complaint data with us. I've left some references in the presentation. So if anybody would like information from these slides, you can feel free to contact me.